Yeah, I think so.
1, 2, 3, test.
Yeah.
1, 2, 3, test 1, 2, 3.
We are going to lower our standards.
Exactly.
You guys start exactly at the level.
All right, so we start in, excuse me, the other time.
No, just start, please. You can set it later.
3, 2.
Good morning, all colleagues who are joining us for this press briefing. I'm glad to say that today we have a very special session where we are rolling out the partnership to accelerate COVID-19 testing, and that is abbreviated Pact. And it has three main pillars, that's test, trace, and treat. So this is a very special component of our response to COVID-19 in Africa. And to do that, I have the honor to be accompanied by the Commissioner for Social Affairs, Her Excellency Amira El Fadil, and also by the Director of the Africa CDC, Dr. John Kengasong. At a later point, we will hear a few words that are coming from our chairperson, that's the chairperson of the African Union Commission, His Excellency Mr. Musa Faki Mahamat, who will be joining us via video. So the program that we have for you today will start with the presentation of the objectives of Pact by Dr. John. Then we will hear from Commissioner Amira. And finally, we'll hear from His Excellency, the Chairperson. After that, we then return to our usual press conference format, where you are free to join us for a Q&A session. So for now, let me quickly hand over to Dr. John. He's the Director of the Africa CDC, and he's going to give us introductory remarks and also present the objectives of Pact. Dr. John.
Thank you, Win. Good morning, colleagues. Again, it's always my pleasure to interact with the media every Thursday at 11 o'clock. It's become a special occasion or opportunity for all of us. We deeply appreciate the role the media is playing as we fight this pandemic. It has been over 5 months or close to 5 months since this pandemic, collectively, the world has been challenged with this, and it is really, we have lived with this pandemic for 5 years just because of the intensity and the speed at which this virus is spreading. Let me then say that, I mean, the media is not just for us to share information, but we see you as a strategic partner in moving this the fight against COVID-19 forward. In terms of the contribution, the fight against COVID-19 forward. In terms of the contribution to inform, to communicate, to also hold us accountable for the things that we say we will do, and if we actually do it. And also to shed light and focus us on things that we may not be seeing and you are seeing from your perspective. So it's truly a strong partnership that we have always strived to have with the media. As of 9 a.m. East African time today, the world has recorded a total of 1 million cases of COVID-19 from over 200 countries, with unfortunately a total number of deaths of about 380,000. In Africa, 54 member states have reported a total of 162,000 cases, with a death rate of 4,600, giving a case fatality ratio of 2.8%. The good news is that about 70,000 individuals who were infected have recovered from COVID-19. Since the last briefing, exactly 1 week ago, last week, there have been an increase of 31% of cases. These are new cases compared to where we were last week. And in actual number, they represent 38,000 new cases from where last week. And the average per day is about 5,400. So last week, we had an average of about 4,000 cases a day, and this week we're observing 5,400 new cases per day. This week, the Southern African region accounts for 31% of the cases, of the new cases, followed by North Africa accounting for 27% of new cases, West Africa 16%, East Africa 13%, and Central Africa 10%. The 5 countries with the most cumulative number of cases include South Africa with 37,500 cases, Egypt with 28,600 cases, Nigeria with 11,000 cases, Algeria 9,700 cases, and Ghana 8,500 cases. These 5 countries account for 59% of all cases reported on the. So let me now transition to the partnership to accelerate COVID testing, which in abbreviation is called Pact. The Pact initiative was launched several weeks ago by the Chairperson of the African Union Commission, His Excellency Musa Faki Mohammed. And this is his initiative, and it was endorsed at the Bureau of the Head of States. It's part of the joint continental strategy that is underpinned by 4 C's. One is that we must coordinate our efforts. Second is that collaboration is important for a continent of 1.2 billion people because we have tremendous assets across the continent that requires coordination. Thirdly is the collaboration, and then fourthly, communication. So these are the key underpinnings of the continental strategy that was endorsed at the Bureau level. The Pact initiative aims to prevent transmission and deaths and minimize the social and economic harm due to the COVID-19 and building strong partnerships to strengthen the effectiveness of the response across Africa. Pact then has 3 pillars. One is to test, to diagnose cases. Second, to trace, to identify cases and their contacts. And thirdly, to treat, to provide treatment and supportive care for cases. We've set ourselves some targets for the continent, and they include the ability to conduct or to increase our testing to 10 million across Africa in the next coming months, the next 2 months to 3 months. Again, let me just put this in context. We're not saying when we hit 10 million, that is a way. As of today, the continent was supposed to be testing about 12 million tests. Okay, that is a continent of 1.2 billion. If we test just 1%, it will be 12 million tests. We are not at that level today. So we are saying in the next coming month, we should strive to get to that target very quickly. Second, to deploy 1 million community workers and community healthcare workers to support the contact tracing and other response activities. Thirdly, to train 100,000 healthcare workers to support COVID-19 response. Lastly, the last target, the 4th target for the Pact is to establish a continent-wide procurement, storage, and distribution platform for commodities required to support the COVID response. As we scale this, I think I just wanted to put this in context, what we are actually doing here. As a continent, as of May 31st, Africa CDC has distributed 2.5 million test kits to member states. Initially, when Pact was launched by the Excellency Musa Faki Mohammed a few weeks ago, the continent's testing ability or numbers were around 450,000. So we've really increased collectively to get that number up. As we speak today, the continent has tested or conducted 3.4 million tests. That gives us our per million total at 1,700. I'll pause here and give you, share some relative comparison with you. Italy's testing per million is 37,000. The UK testing per million is about 30,000. So as a continent, we are at 1,700. So just to put that in context so that we know exactly the work ahead of us. Our target is to make sure that we raise this ratio, that is a test per million, to about 10 million so that we can move ahead of a pandemic. So the Pact will hope to increase this testing, but do that very, very collaboratively with everybody here. Let me then acknowledge the partnerships that we continue to have and enjoy with the World Health Organization, the UNAIDS, the European CDC, the International Federation for Red Cross and Red Crescents, the Bill and Melinda Gates Foundation, the Jack Ma Foundation, the Susan Buffett Foundation, the African Standby Force, which just recently lifted about 28 of our responders to several countries, including Burkina Faso, Cameroon, Mali, and Niger. And most recently, other partners that are joining, which Commissioner Amira will announce very shortly. So thank you, ladies and gentlemen, and I'll turn the floor back to Wayne to continue the program.
Thank you very much. That was Dr. John, just introducing the partnership to accelerate COVID-19 testing, or Pact, that we are rolling out today. Next up, we will have the Commissioner of Social Affairs. But before I hand over to the Commissioner, let me just remind you that for our Q&A session, the means by which you can send in your questions are, firstly, to send to WhatsApp number +251 9455 02310, +251 9455 02310. Alternatively, you can just type in your name and your organization into the chat column on Blue Jeans. We are also coming to you live in case you might be having challenges on any one of the channels that you are using. We are on a number of platforms. So we are on this Blue Jeans platform. We are also on YouTube. We are also on the African Union Facebook page, and we are also live streaming. So there is any number of channels that you can utilize to get to this press conference. It is now time for me to call upon Her Excellency, Mrs. Amira El Fadil. She is the African Union Commissioner for Social Affairs, and she is going to give us a few remarks about Pact. Commissioner.
Thank you very much, Winnie. Good morning, journalists in the room and through VTC. Fighting COVID-19 in Africa is not only about saving lives today, but also it's about tomorrow. It's about the future of this continent. It's about implementing our Agenda 2063 for the Africa we want. Because the Africa we want is peaceful, prosperous, and driven by its own people. And when we see driven by its own people, that also means protected by its own people and safeguarded by its own institutions. And that's why our leaders, our heads of states and government, the two leaders of Africa now, the President of South Africa, the AU Chair for 2020, and His Excellency Musa Faki Mohammed, the Chairperson of the African Union Commission. They led this fight, and they led it on behalf of the heads of states and governments of Africa, as being endorsed by the Bureau of the Assembly. So they are leading this fight to make sure that our aspirations for the Agenda 2063, for the Africa we want, is clearly and strongly implemented by strengthening our technical institution for fighting epidemics and pandemics and endemics in Africa, which is Africa Center for Disease Control and Prevention, known to all of you as Africa CDC. So my first point is to appreciate this leadership and the support we are getting from our leaders to go ahead with the implementation of our joint continental strategy on COVID-19, which is just being mentioned by the Director of Africa CDC, Dr. John. My second point in this briefing is to say that while we are implementing Agenda 2063, which is fully aligned by Sustainable Development Goals 2030, we are also implementing our catalytic framework, which is also led by the African Union Commission, the catalytic framework on ending HIV, TB, and eliminating of malaria. And from this division that's responsible and leading on the implementation of the catalytic framework, ATM, Africa CDC was born in the beginning. So we are on top of the implementation of the policies we have, and now we have our continental strategy, which is adopted by the emergency meeting of the Ministers of Health and later endorsed by the Bureau of the Assembly. And we have the structure that's following up on this implementation, whether the Ministerial Coordinating Committee that includes the ATREX and includes also NEPAD, plus having technical levels. I'm sure Dr. John shared with you in the previous media briefings the information about the technical task force that's leading the implementation on the technical level, and which includes representatives from all over Africa. I would like also to speak about the role of Africa CDC in building the capacity of our member states. And here I would like to say that there is a continuation of the programs of the training and the capacity building that we are doing in all levels, and we are doing it with our member states physically before these lockdowns and online training after the lockdowns, but it is a continuous program of building the capacity of our member states and the capacity of the technicians, whether the lab technicians, what Africa CDC to build did to build the capacity of the continent in the area of the diagnostics. We started with 2 countries have the capacity to diagnose coronavirus. We ended up with, if I'm correct, 48 or more member states. They have the capability to diagnose COVID-19, and this is very important when we speak about testing. And in Pact initiative is about testing. So we cannot roll out this initiative, the Chairperson's initiative, without making sure that we have the capacity in our member states to test, to do the testing. So I appreciate very much the role of Africa CDC and the partners and the leading partner, WHO, in building this capacity in our member states, because it's not only about COVID-19, but it's also about the future of building the capacity of our health systems and health institutions in Africa. So it is a crisis for us. It's a global crisis, this pandemic, but also it's an opportunity to accelerate our efforts in building the capacity of our health institution in the continent and building the systems, the health systems in our continent. My third point is about what can be done, because when it comes to health and health services, we always speak about 2 issues. We speak about treatments and we speak about prevention. I'm not a medical person, but I know from the medical people, from the experts and the technical people, that till today there is no treatment for coronavirus. There is different protocols on treatments in different countries, but till today there is no treatment. When we come to prevention, the very thing the experts are telling us that there is no vaccinations, there is no vaccines for coronavirus, and we need minimum 6 to 12 months for a vaccine to be developed. So even when we come to prevention, our choices of putting solutions are limited. The solution we left with is preventing more transmissions by doing more testing, and tracing. And this is what Pact is about. Pact is a partnership to accelerate COVID-19 testing in Africa. By testing, by helping and supporting our member states to do more testing, to trace, to identify the infected persons, and to isolate them. By doing this more testing, we will be able to control the virus, and we will be able to minimize the number of the transmissions. And this is the most effective tool. Now we have it in our hand, and that's what's been implemented in different continents, in different countries, and it's proved itself as an effective tool. That's why the chairperson of the African Union Commission launched this Pact initiative as an initiative coming from His Excellency, and today we are rolling it out. That's why we think that the 10 million target set by Africa CDC is not our limit. It is just what we are planning to do within our capacity, within the timelines that's been mentioned by Dr. John. But our expectations that member states will do even more. They can double this number. And they can do it by having also our support. And the support of Africa CDC is not just in building the capacity in the diagnostic area, but also in providing the testing kits. And that's what we are doing since the beginning. There is, I will leave the mentioning of the numbers to Dr. John, but I know from following up the work of Africa CDC that we have provided member states with thousands and thousands of testing kits directly going from Africa CDC, being purchased by Africa CDC, but also from the donations we received from our partners, especially the Jackma and Alibaba Foundation donations. The two first donations came through the government of Ethiopia and the Prime Minister of Ethiopia, and we appreciate his role. And the third one, which came for the African Union and Africa CDC, and just being delivered to our member states last week. So we are also giving the member states the in-kind support to do the testing. My last point, it will be on partnerships, and John also mentioned many of the partners, and I can say that we have too many partners to be counted. John mentioned many of them. I would like to mention a few of them, but still we will have partners that we can ask you just to go to our website because there are too many to be counted. But the support we are getting also is not just from the partners. There is an internal support from the Commission itself in terms of financial resources and budgets. From the budget of the Commission, member states, they decided to allocate $25 billion for Africa CDC for the fight of coronavirus. We have also established the anti-COVID-19 response fund. We elected the chair and the vice chair, and we have pledges made by our member states. We have money being transferred in the two accounts of this fund, and this fund is going to be used by Africa CDC also for the support of our member states. So we are getting the support from the Commission itself, from the member states, but also from the private sector in Africa. And also here allow me to appreciate the partnership we have with the private sector in the continent. We have 5 special envoys that working with us, working on in the area of having economic stimulus packages for our member states, because we know that this impact of coronavirus is not only on the health sector, but it's on the economic sector, on the losing of jobs, in shortage of food. So it's affecting all the elements of our life. And that's why the 5 special envoys, they are working with the international monetary institutions, IMF and World Bank, G20. They are working on having a debt relief for our member states in Africa, especially the poor countries. They are working on having a moratorium on paying the interest and having more loans and more funds to our member states to make sure that our economies will not be hardly hit by this COVID-19. But also I would like to appreciate the partnership we have with the private sector in the area of providing Africa with medical supplies. Just like yesterday in a joint ministerial meeting between the Ministers of Health and the Ministers of Finance and in the presence of the 5 special envoys, plus our chairperson of the African Union Commission who gave the opening remarks in the meeting yesterday, we have endorsed and launched the platform for medical supplies, and this platform for medical supplies is also chaired by a man from the private sector, Mr. Strife Masewa. He has been appointed by the chairperson of the African Union, President Ramaphosa, and yesterday he presented the proposal which was endorsed by the ministerial meeting. This platform is available to all member states. They can go, there is an application, the member state, they can go and they can order what they want to buy. The platform chaired by Stripe Masewa already spoke to the manufacturers in different parts of the world, and they have a projection of the needs of the member states. This is a very big step forward, and we are doing it, and we are expecting it to support and to help our member states, because when we imagine that member states that will go on bilateral level to look for manufacturers and to buy, how many brokers in the middle, the time they need, the financial constraints. But by this platform, we are giving them solutions. Even for the financial side, we are putting solutions. In conclusion, I would like to appreciate very much all of our partners. I mentioned WHO, but there is many partners from the United Nations agencies, from international organizations, from foundations in different parts of the world. But also I would like to hear, because we are talking today about Pact, it's about testing, tracing, and treatment initiative. I would like to mention the MasterCard Foundation and appreciate very much their support. MasterCard Foundation is supporting Africa CDC with $39+ million for this Pact initiative. I would like also to commend and to appreciate the government of Canada for the $2.5 million also for Pact initiative. The government of Spain also, they are giving $2.7 million for Pact. I've just mentioned the 3 partners because the money and the donations coming from them, it is mainly for Pact initiative. But we have too many partners to be counted. As I said, all of them, they are supporting financially, they are supporting technically, and they are supporting us in implementing the joint continental strategy on COVID-19. My appreciation again to the leadership we have here on the level of the African Union, and also to our partners who are supporting us and supporting Africa. They are supporting us to make sure that Africa will be least affected by COVID-19, whether in the health sector or in the areas of the socio-economic impacts. I would like to thank all of you, to appreciate, my last sentence is to be to appreciate Africa CTC staff, and to appreciate Dr. John, Dr. Ahmad, Benjamin, and all the leaders of this very important institution. Thank you very much.
Thank you very much, Bill, the Commissioner of Social Affairs right here at the African Union. Now, the Commissioner mentioned that the Pact program is being championed by the Chairperson of the African Union Commission, His Excellency Musa Faki Mahamat, and we have him on video to give you a few words. Colleagues, we'll be with you just now. Just give us a few seconds, please. Thank you.
Response. We have set 4 goals for Pact. 1. Expand testing for COVID-19 by 20 million tests per month. 2. Continue training health workers on the continent. 3. To establish a platform for pooled procurement at Africa CDC. And 4, to deploy 1 million community workers to trace the contacts of all confirmed cases. Pact is also key to ensure that we are able to conduct our economies in a safe manner. Pact is a vital component of the continental response as we respond to the COVID-19 pandemic as well.
Thank you very much. That was the Chairperson of the African Union Commission, His Excellency Musa Faki Mahamat, and he was stressing there the importance of Pact, calling it a vital component of the continental response. Thank you so much, everyone, and thank you to Commissioner and Dr. John for this part of our press conference. We now move into our usual Q&A, and let me just remind you of the numbers that you can use to send in your questions. The first one is a WhatsApp number, +251 9455 02310. Alternatively, you can type your name and your organization into the chat column. And I'm very happy to see that our screen is very well populated today. Thank you so much for your interest in joining us. Let me give you our first question. And this one is coming from Michael from Tunacheki. And Michael says, there is almost a simultaneous surge of new cases in African countries. Is Africa starting to lose the grip in the control of the virus, or is this due to the increased testing on the continent? Secondly, Michael says, also explain why hydroxychloroquine is being discontinued as a viable treatment in some African countries, and should all of Africa stop using that treatment? Dr. John.
So thank you, for, Michael, for that very good question. We had in several instances in this same press conference warned that we would our situation would likely get worse before it gets better, and we started up early. We organized, the continent has been organized in an extraordinary manner, as Commissioner Amira mentioned, with the highest leadership of the continent engaged, the presidents at the bureau level, and several committees of ministers of health, ministers of finances, and ministers of transport, and then the task force, which some of you are part of it. So that early phase organization and coordination helped a lot in blunting the spread of COVID on the continent. As we begin to relax some of the lockdown measures, which is part of balancing between saving lives and saving the economy, we expect to see that numbers will increase. But what is important is that the lockdown period allowed us to intensify our public health measures, which is exactly to test, to track, to trace, and to isolate and do the basic things. I think that is one. Second is that our testing capacity is increasing, and increasing very, very rapidly. Just a few weeks ago, about 6 weeks ago, we were just under 500,000 tests as a continent, and today you heard me mention that we are moving up speedily to about 2.4 million tests. As we increase our testing, we expect to see more cases there, which is a good thing. You see more cases, and then you find that you isolate them, and then find that do the contact tracing. So it's better than not knowing where the cases are, and which will completely blindside you, and then you get overwhelmed by this. So that's why I say the numbers may get worse before they get better as we increase our testing. So again, that is why the Pact initiative is so important. We want to, as much as possible, dig out where this virus is hiding in our community, find them, flush them out, and then get back to normal. I think that's the whole purpose of this. So we expect that our numbers will increase, and we should absolutely know that it's not necessarily a bad thing. It shows that we are intensifying the ability to trace and or identify these individuals in the community. Then the second thing about hydrochloroquine, we issued guidelines about 2 months ago on the use of chloroquine or hydrochloroquine, and it's very clear. People can go to our website and see what we said at that time. Our position remains clear that chloroquine should only be used in the context of when patients or individuals are under clinical trials, so that they should be monitored effectively. As we speak, there are so many clinical trials that are ongoing in Africa and outside of Africa. So we are waiting to see the outcome of those clinical trials, and then we can make adjustments on our guidelines. But for now, we are sticking with the guidelines that we published a few weeks or months ago.
Thank you very much. Sarah Jerving with Devex, with the rollout of Pact, what are the changes on the ground? This is one. Second, what resources have been given or will now be given to countries to increase testing that is different now than before this rollout? Then third, does anything change, or is it a continuation of ongoing efforts?
So several things would change with the rollout of of Pact today. Pact is a tight focus program, and you heard the chairperson of the African Union Commission, His Excellency Musa Faki Mohammed, laid out the goals of Pact. And let me just repeat some of the things that he said. One, number one goal, as he indicated, was that we needed to increase our testing very quickly to about 10 to 20 million tests. That way we move ahead of the curve. So this is a call to action, which means we have to rally everybody. It's not just what Africa CDC will do, but all the partners on the continent and donors have to support this both at country level and at the continental level. So that is going to change. The second thing we mentioned here was the need to support the deployment of 1 million community workers. Very, very important. If you test, you must trace the contacts. Otherwise, the testing doesn't make sense. So I think the chairperson's order to us and launch of that initiative is very, very important for us. I think as we speak, South Africa is using about 28,000 community workers to support this, and it's a call to action that the chairperson is giving us. So that will change. We see that with your support and other partners will roll this out. The third thing the chairperson mentioned was the platform. This is going to be a game changer. The platform that Commissioner Mirad expanded on is important. Let me just come back to that for 1 second. It is going to be an electronic platform where a country can actually go on, and then you pull stuff that you need into a basket, and you arrange with the Exim Bank and others for payment. It will do two things. One, you don't need to go search the market anymore, because we have searched that market for you and accumulated and secured those products. Second is that the price has been agreed on and determined. So at a very, very competitive prices that we don't believe that if you go out of that platform, you'll find a similar price in there. And if you find similar pricing, then you go elsewhere and you get them there. But it is an opportunity to unlock the supply chain management for the commodities that we need to fight COVID-19. What that platform has done for the testing is that it has secured about 15 million tests per month for the next 6 months. So I think the issue of access to tests and availability it will begin to be eased out. Fourthly, is that about 5 countries already are going to be using that platform, as it was announced yesterday, to start testing the platform. So the Pact completely changes the dynamics of things. We know countries were reaching out to us and say, look, John, we have the money. We don't know where to go buy stuff. Help us. So that dynamic changes as from today, actually, as we heard yesterday from a joint meeting of all ministers of finances on the continent and ministers of health and the invoices and the AU. So it was, really the highest coordination that we have ever witnessed at a continental level. So that addresses the question of resources. Now, lastly, we also heard from Commissioner Mira that there are special invoices that President Ramaphosa has appointed, and they are all economic invoices, and they are working very, very hard to work with the bilateral and multilateral systems globally to make sure that money is available to the continent in a manner that is predictable and they can use in supporting the response to this. I think that conversation is happening. They've really secured several billions that is not going to us, but going to the countries, and that is exactly where it should be. So the task now is for the countries' ministers of finance to release that money in a timely manner, so that the ministers of health can use it to support the rollout of Pact in the country. I think that is a lot is going to happen because of this very tight focus program launched by the chairperson of the African Union Commission.
Thank you very much. We'll take people who are online. Let's start with Munganzi David Jolly of Africa Youth Front. Munganzi.
Yes, hello, thank you very much. I say that Munganzi David Jolly from Africa Youth Front, and I have a question. I have 3 questions. And the first one was young people would like to help in delivering Pact. What is one of the priority areas Africa CDC would need our contribution, and given that Africa has the youngest population, this would be very important for us to contribute. And the second question is, the plan is to test 10 million, but only train 100,000 health workers. Is this sufficient for our continent with over 1.3 billion people? And the last question is, to ensure no one is left behind, how will Pact be able to reach conflict hotspots and areas with insecurities? Thank you very much.
Thank you, Munganzi. Commissioner.
Thank you very much, and you are giving me the opportunity to appreciate our young Africans and to appreciate the initiative, the Youth Front Against COVID-19, which was launched jointly between us in the Social Affairs and Africa CDC, and this special youth envoy, Ms. Aya Shepi. This front also is supporting in the area of raising awareness because we agreed that young Africans have the opportunity through the initiative of the Africa Youth Front Against COVID-19 to participate from the continental level to the regional level to the national level, going down to the grassroots level and the community level. Through this partnership we launched together. But not only that, all the civil society organizations, especially youth and women organizations, they have the opportunity to participate in the area of raising awareness and disseminating of information and sharing of data on COVID-19, but also they have the opportunity to be part of the community health workers. And we are aware that a lot of young Africans joined this course of volunteers, the one we have from since the Ebola outbreak in West Africa, and new ones are joining. Our target is 2 million health workers, but when we set a target of 2 million, we always have the ambition that we will have more. This is the minimum we can do, but we can have more. So I think young Africans have a big opportunity to be part of this fight, not only through the front we launched, but also through all the networks of the youth organizations in Africa. I know a lot of them are joining this fight. As I said it at the launch of the African Youth Front, that the young Africans are more connected, they have more knowledge in the use of the technologies, they can be very supportive in creating more online platforms, they can liaise with each other, they can join their efforts. So there is a big opportunity, and I appreciate the front initiative, but also we can have more areas of cooperation for the fight against COVID-19, because the future is for you. All the things I mentioned about the Africa we want is for young Africans, because the majority of the population in Africa is young. To ensure no one is left behind by having everybody in this fight. We need the communities, we need the community leaders, we need the religious leaders, we need the non-governmental organizations, we need the cultural workers, we need everybody in this fight to make sure that nobody will be left behind. It's not only governments. Yes, we are leading on the governmental level, we are pushing our governments to act, but we know that governments alone cannot win this fight. So we need everybody to be included to make sure that nobody will be left behind. Thank you.
So let me just supplement two things. One is that the numbers we are giving are not, we need to strive to collectively to exceed these numbers. The 100,000 that healthcare workers, that the training is the TOTs that we need, the training of trainers that will cascade that into the different countries. The 1 million number is the lower end of it. So I think we should be striving to have more. I mean, we, as Commissioner Miller said, this is going to be the victory against COVID will be led and owned at the community level. It starts in the community, it ends in the community. So how much this we engage the community, build trust and the relationship using this community healthcare workers program will determine how quickly we win this battle against COVID-19. It's standard. This is when you're fighting a disease where there is no treatment and vaccine. You rely on basic public health measures to ensure that what is known over the years and over the history of public health as standard shoe leather epidemiology. So this will be their foot soldiers to go after go into the community and actually help us know where this the virus is hiding and flush it out there. We must beat this beast to come to normal. Absolutely no doubt about it. And the way we do this is, of course, Africa CDC and the Commission and WHO, we don't have all the answers, but we know that collectively we will find the answers and we'll learn as we go. This is a new virus. We have known this virus for less than 5 months, and we will continue to learn and adjust our strategy. Our only failure collectively will be out in the failure to recognize that we shall fail, and we shall learn from the failures and then build again and move on until we defeat this virus.
Thank you very much. May I just ask those who are joining us on either YouTube or Facebook that if you want to ask your questions, please use that WhatsApp number that we have provided, and it is +251 9455 02310. Let me call upon Michael, who is joining us online. Michael. Hello, Michael. Please go ahead.
Yes, can you hear me?
We can hear you.
My question was, will Pact leverage the extensive experience that Africa has in managing other infectious diseases, HIV, TB, etc., to their strategy for this project? Thanks.
Dr. John?
The answer is absolutely yes, and it's already doing that. I mean, South Africa's success in aggressively increasing its testing to about 12,000 people tested per million is thanks to the aggressive nature in which they've used community workers there. And this is actually borrowing from their experience in fighting HIV AIDS in South Africa. And we're also seeing that in several countries in West Africa. So we have to absolutely build on those endemic diseases that we have been fighting for so many years. And I'm happy to see a lot of HIV combatants, like Professor Lashley Abimeko on this call, and others that have been on the struggle for so many years, that we are counting on them to use that community engagement strategy and the wisdom acquired from TB, malaria, and HIV to apply that to this infectious disease. Let's demystify COVID-19. It is an infectious disease. We know how it is spread. We know how we can win the fight. It will require a community engagement and using lessons we've learned from HIV, TB, and malaria to fight it.
Amadou Gay, if you are with us, please ask your question.
Hi, good morning,
okay, and I'm actually working from the industry. We are manufacturer of laboratories. I wanted to ask, what is the serology test? The antibody and antigen test will be used for in this Pact initiative, especially when we know that molecular testing will not always be available in every Africa setting.
So that is a good question, and let me answer that question in three parts. One is that again, this is a new virus. I know I'm repeating myself, but I need to remind everyone that, which means, what does this mean? It means we'll continue to learn how to develop technology that will be adapted to the response. And we also saw this in HIV. Again, our HIV combatants are on this call, and they know that technology for diagnosis of HIV has evolved over time. So we expect that the diagnostics for COVID-19 will continue to evolve. With respect to serology, we will be issuing guidelines on how to use serology tests to enhance ability to understand this virus absolutely next week with Africa CDC guidelines, and I'm sure WHO will also issue some guidelines, but colleagues have been working together as a continent to issue those guidelines, and they will help address some of these, provide clarity to countries as to how to use serology and complement the molecular testing, the PCR, which you indicated. The other good news that I really like to share here is that there are at least 4 countries now that are taking on themselves to begin to manufacture locally. Either the antibody test or the molecular test. That is, to the best of our knowledge, and based on the coordination that we have with the Africa CDC, Senegal, Morocco, Kenya, and South Africa have all engaged in the development of these diagnostics, which is extraordinarily important because as we speak today as a continent, until recently, absolutely, besides Morocco, no country in Africa was investing in the development of diagnostics. So COVID is pushing up us to actually to the frontiers of discovery, which is again going to be the first time that we are beginning to use products made in Africa. And I can't wait to see those made in Africa diagnostic tests that will be used to fighting COVID-19.
Up next, we have Kara Anna. Kara.
Can you hear me okay?
Yes, we can hear you well. Please go ahead.
Thank you. And you may have addressed this earlier, just the audio has gone in and out. I wanted to know what obtained for Africa. Thanks.
The pool platform, Kara, has attained a lot. This is truly, I'll characterize it as a breakthrough. I don't know the exact numbers of quantities there, but we'll be happy to, it's public information. I'll be happy to send you this, or anyone else who reaches out to us will send you a comprehensive list of things that are on the platform. But I know for sure that diagnostics we have been secured in abundance, about 15 million tests per month for the next 6 months. We are projecting that we have to beat this enemy and defeat it in the next 6 months. And if we scale up our testing, if we do the tracing, and if we do the treatment, that is, we can contain it, push it back as much as possible. That's why our projections are in the platform are for the next 6 months or so. We recognize that this is a serious battle, that it can be protracted. But we are, as any battle that we fight, we are setting ourselves some immediate targets and say, well, in the next 6 months, let's scale up our testing, let's scale up our tracing and treatment so that we can do it. So based on that, we have a series of things that are on the platform that we can share with you by email.
Thank you very much. I'm going to take a question that has come from our WhatsApp group. I am Ronald Tatenda Magomo from the Africa Youth Front on Coronavirus, AYFC. The question, with regards to the high levels of corruption being reported in some AU member states, is there a mechanism to engage the youth as accountability partners on Pact resources, which will be channeled to AU member states?
We have actually not thought about, not characterized it as such, but rather issues of governance, which is very important and central to any initiative there. So we are very open to any suggestions that you can make. You have our email addresses. Bring forth any suggestions, and we'll be happy to take a look at that. I will just end up by saying that on this particular issue, that we are in this together. It is a fight that we must win as a continent to survive, and all ideas are welcome into the pool of the basket of ideas that we want to all explore. Yes.
Yes, please. I would like to add in this area of accountability and transparency, all the funds that's coming through us as African Union, it will be governed according to the financial rules and regulations of the African Union Commission. We will follow up. We will be responsible about reporting back about the utilization of the funds, whether the funds are coming from our member states themselves through the Commission or from the international partners. So the frameworks of accountability is available. We have a known reporting systems. We are sharing information and there is full transparency of sharing the information, maybe by sharing the information about the availability of the funds and how much is being allocated for which country. You can have a role as African youth in following up on the national level, and also you have your NGOs that they can follow up, and it's known the mechanisms that where you can also support in the area of having more accountability and more transparency. Thank you.
Thank you very much, Commissioner. We are overshooting on time, but we'll try to make it as concise as possible. This one is a follow-up to an issue that was addressed by Dr. John, coming from Robbie of AFP. And he says, when was the online storage and distribution platform launched? And which 5 countries are using it? When will it scale up? And Dr. John, did you say that it had secured 15 million tests per month for the next 6 months?
Yes, the 15 million test is valid. So let me be very clear about this. So the platform was presented yesterday to the combined meeting of ministers of finance across the entire continent, ministers of health, the African Union Commission, and the special envoys there, and which were named by President Ramaphosa. It is here that maybe I should break and recognize and amplify what Commissioner Mira said, that one of the envoys, a prominent African business person, Strive Masiwa, is leading this effort to establish the platform as his own contribution and as a special envoy appointed by President Ramaphosa. So that is step 1. Step 2 is that the launch of the platform itself will be made by the President of the African Union, President Ramaphosa, in the coming weeks. The official launch will be, and that is what we are sharing with you the whole process in the spirit of being totally transparent with what is going on. The 5 countries I mentioned are countries that will go in there and use that as a test case to see what how the platform works. And I think again, still in the spirit of testing a system that has been put in place, and hopefully by next week, when it's officially launched by President of the African Union, President Ramaphosa, I think you have on the 11th of Commissioner Mira says 11th of June, I think is where the launch itself will be. So I wanted to provide that clarity to you all.
Thank you very much. We've been given an extra 10 minutes and we have 4 people lined up for questions. The first one is Lindsay Elton. Lindsay, please, if you can hear us, go with your question.
Hello, yes, my name is Lindsay Elton and I work for the Pandora IDNet Consortium, which is a research consortium with many different African partner sites. And my question is the Pact Consortium going to provide assistance for sort of procurement research projects and initiatives, or is it purely for clinical diagnostic testing and tracing?
So the Pandora is a key partner, and I'm sure that you are participating as part of the African Task Force for Coronavirus Preparedness and Response, abbreviated AFCOR, which meets every Tuesday at 4 p.m. We strongly encourage Africans with the right expertise to be affiliated with this. This is a task force for all of us. There's a specific working group there for science, research, and standards and regulation there, which if there are any ideas that Pandora has to bring to the table, that is the platform to present that. Now, Pact doesn't summarize everything that we are doing in this response. Pact's intention is to focus the response on certain things. Okay, the research part of it is critical to it, but as the chairperson is directing us to do 4 things, major things, and the research, of course, component of it is still an integral part of our response. But again, we need to do certain things quickly, and those are the things that are underneath part. For example, maybe I should just mention that you will, in the coming days, be notified that Commissioner Amira and Chairperson of the African Union Commission will be hosting a very high-level meeting on access to vaccines. That is a research and development component, but in the coming days, they will convene a very high-level meeting across the continent and the world to begin to chat and discuss the pathway for Africa's access to vaccine, what we as a continent must be doing and have to do, so that when vaccines are available, we are not at the tail end of it, such that we are not just waiting for vaccines to be developed. We want to be part of the research and development, and how do we engage with the community. So I say this to just highlight the fact that not everything that is has to do with COVID-19 is underneath part there, but these are some very urgent things that the chairperson thought that it's important for us to focus us so that we can achieve and deliver those.
Thank you very much. Let me now acknowledge Alashli Abimiku. Alashli Abimiku. I could see the name a few minutes ago, but I don't see it anymore. So perhaps let's move on to Mary. Do we have Mary online?
Yes, good afternoon.
Good afternoon. Please go ahead with your question.
Yes, considering the low testing levels in Africa, the government's delay easing of the restrictions put in place to contain the spread of the COVID-19 disease for a month or so.
No.
It's not clear.
Can you come again? We did not quite get you.
Okay, good afternoon. I come again.
Yes, please.
Considering the low testing levels in Africa, because the capacity remains low. So should the governments in Africa delay easing of the restrictions put in place to contain the spread of COVID-19?
So that's a very good question, Mary. We have provided guidelines on how to ease the lockdowns, and with clarity on exactly what to do. And I strongly encourage that you go to their website and look at those guidelines that we've provided, and they're being distributed to all member states. So I think we are very clear that, our rates are low, but they are increasing. I like to leave you with this that it is clearly in the right direction. When we launch, the chairperson launched the Pact a few weeks ago. Our numbers were around 400,000. Today we are around 2.4 million. So 2.5 million. So I think we are in the, and we have set ourselves a target of 1 million tests to be distributed. We exceeded that significantly, and I think we should put that in the context. So the short of that is that please go to our website and see the guidelines on easing the lockdown, so that we can all coordinate our efforts and do the on easing in a coordinated and safe way.
I would like to add also, Mary, that the decision of the lockdowns, it's a decision made by the member states. And on different levels, and the timetables are different from one country. It is a precautionary measure being taken to minimize the numbers of the transmissions. But because it's taking long, these lockdowns, it's affecting the livelihoods of the population, whether in Africa or globally. And countries, they have to balance between saving lives and minimizing and reducing the numbers of the transmissions and saving the livelihoods. To do so, what African CDC did is developing a guidelines. It is not legally binding. We cannot impose it on member states, but we are giving member states the advice if they decided to ease the lockdowns, how to do it scientifically. But part of these guidelines, there is some prerequisite. It has to be in place before starting using the lockdowns. The top of it is by conducting more testing. And that's why Pact even more and more important, because if countries, they want to ease the lockdowns, they want to follow our advice and our guidelines, they need to start by increasing the level of the testing in the country before opening up, and to do this opening up gradually. And also, again, it depends on the epidemiological situation of COVID-19 within each country. But we cannot advise them or go ahead and have more lockdown. No, it depends on the situation in every country. We provide them with the information. We provide them with the guidelines on how to do it, and how to do it, bearing in mind that they will have the minimum transmissions while they are easing the lockdowns. Thank you.
Thank you very much, Commissioner. And I can see we still have a number of colleagues who are online, but unfortunately we've run out of time. We've tried to extend and have added an extra 15 minutes to this briefing, but we really have to conclude. May I ask that those who are just still joining us online, please send us your questions to +251 9455 02 310, and we will have to respond to you at a bilateral level. But otherwise, I want to thank you very much for joining us, and to thank Her Excellency Commissioner Amira El Fadil and Dr. John Kengasong for joining us in the launch, rather in the rollout of the Partnership to Accelerate COVID-19 Testing, which is known as Pact. We trust that you will join us again next week. Thank you.